A new report has revealed that rare and less common forms of cancer are the most common cause of disease-related deaths in Australia. These types of cancers claim the life of one Australian child aged under 15 every 4 days, making them the #1 killer of Australian children. Dr. Toby Trahair is a paediatric haematologist and oncologist at the Kids Cancer Centre in Sydney's Children's Hospital, and he joins me now from Canberra. Dr. Toby Trahair, good morning and thanks for sticking with us. I know you've been there waiting for a while. Now, is it the case that these rare cancers have grown in incidence over the past decade, or have they always been about this proportion?
Certainly rare cancers are more recognised, and it's also very clear that their survival is not as good as some of the more common forms of cancer. And increasingly also we're recognising even within some common cancers there are rare subtypes that can be very difficult to treat, but that may respond to new therapies that are being developed at the moment.
Yeah. And what are some examples of the cancers you're talking about here?
So I've been involved with one of my patients who's had relapsed Hodgkin's disease, a difficult disease to treat. Again, didn't respond terribly well to his relapse therapy, and there's recent data to suggest that new targeted therapies can be effective at improving the outcome in difficult to treat relapsed Hodgkin's disease. So my patient, we've been able to access some therapy for him for that. There are also some targeted therapies for some rare subtypes of lung cancer that have shown some success. But increasingly there are also rare cancers where we may not currently have new therapies for them, but it's also very clear that we also need to prioritise research to find better cures for these rare diseases.
And these are cancers affecting not only the young but people of the baby boomer population as well?
Oh, that's correct. I mean, rare cancers actually occur all throughout the whole population, so all the way from birth up into the elderly age group as well. But it's a particular impact also in young people, particularly at the time that they have families of their own and children of their own as well.
And what are the challenges with access to subsidised medicines for people with these cancers?
Yeah, this is a real challenging issue at the moment because for many of the rare cancers there may be effective treatments out there that have been recognised and developed internationally. Often these treatments actually aren't available locally in Australia through the PBS because they are so rare. And then sometimes also we get new treatments that become available and there's good data to support using them, and although they may be available in Australia through the PBS, they actually may not be available for that particular disease, which is the problem I faced with one of my patients with the relapsed Hodgkin's disease. So we had to be able to access a new treatment for him, wasn't available on the PBS for his particular disease.
Yeah. Is this a case of the cancers that just don't get as much publicity as others, so there's not as much awareness and support?
That's one of the primary goals at the moment. So Rare Cancers Australia, they're really trying to advocate for improved awareness and knowledge of rare cancers, to also galvanise research into rare cancers so that we have a better understanding of why they occur, to identify better treatments, but also really to galvanise the community to also help make sure that we can get treatments available in a timely fashion for patients affected by rare cancer.
Yeah, OK, Toby Trahair, thanks so much for talking to us this morning.
Thanks very much for the time.